Hello everyone, welcome back to Pathoman. Today let us study the histopathology of colloid goiter of thyroid. So the colloid goiter of thyroid is a non-toxic condition. That means it does not have any malignant potential. There is no risk of malignancy. It is a benign condition and it occurs because of the most common reason being the iodine deficiency. Iodine deficiency is the most common cause of colloid goiter, followed by increased physiological demands. Increased physiological demands as in puberty, pregnancy, and lactation. So these situations pose increased demands for iodine, leading to iodine deficiency situations and ultimately causing this colloid goiter. So the colloid goiter of thyroid is characterized by like diffuse enlargement. There's a diffuse enlargement of the entire thyroid gland, unlike like multinodular goiter, wherein you can find multiple nodules on the surface. So whereas in colloid goiter, there's diffuse enlargement of the thyroid, and it occurs because of accumulation of colloid within the follicles. So this is the histopathology of colloid goiter in a scanner view. In the scanner view, you can see this fibrous capsule. That is a thyroid capsule. This is the thyroid capsule. Here you can see there are multiple follicles, and these thyroid follicles are of variable size. So there are small and big follicles. There's a huge difference in the size of the follicles, and this variable sized follicles is a characteristic finding of a colloid goiter. And also, you can see like there is a hyalinization of some fibrous tissue. So this is the fibrous tissue over here. So some parts of the fibrous tissue get hyalinized. There's eosinophilic, like acellular eosinophilic material is the hyalinization. And coming to the hypo view of this thyroid follicles, you can see there is variable sized follicles and they are lined by like flattened epithelium. There's a flattened epithelium, or you can say low cuboidal epithelium. That indicates the epithelium is inactive, and there is like hugely like excessively filled with colloid, excess accumulation of colloid within the follicles. And here you can see there's an area of hemorrhage along with some cells. It could be a macrophages. In this view, you can, with this clarity, you can find out to be a macrophage. So this hemorrhage, like old hemorrhage, it indicates it could be a possible FNAC tract if this patient has undergone an FNAC procedure prior to the thyroidectomy. So here in this view, you can see there's area of hemorrhage, and here not so very clear there are cells within the hemorrhage. And here you can find like this dark pigment. This dark pigments are nothing but calcifications. These are the calcifications. Here's another calcification. And this hyalinized material is nothing but this eosinophilic material is nothing but hyalinization of the fibrous tissue. So in this slide, you can see area of hemorrhage along with macrophages, calcification, hyalinization of the fibrous tissue. Coming to the slide, here you can see very large area of hemorrhage. When you zoom into this hemorrhage, one of the foci, here you can see the background is hemorrhagic necrosis. Yeah, but here these cells, you can observe these cells, and these cells contain a brown pigment inside them. There's a brown pigment, these brown dots. This brown pigment is present inside these cells. These are called siderophages. These are called siderophages. These are nothing but the macrophages that has engulfed the hemosiderin. So the hemosiderin-laden macrophages are called siderophages. It indicates an old hemorrhage in the thyroid tissue. So the background is suggestive of an old hemorrhage. You can visualize the macrophages with brown pigment in their cytoplasm. That is nothing but hemosiderin-laden macrophages. Because when there was a bleeding into the tissue previously, the macrophages has come into the bleeding and they have engulfed the hemoglobin released from the lysed RBCs and they turn it into hemosiderin. So the hemosiderin-laden macrophages are called siderophages. This is also a characteristic feature of secondary degenerative changes. So this is another foci showing you a beautiful area of old hemorrhagic necrosis on one side, and to the other side here this long needle-shaped spaces. These are called cholesterol clefts. These are nothing but the cholesterol clefts. Here again, this total zoom in, you can see this beautiful long needle-shaped like pointed spaces. These are cholesterol clefts. These are cholesterol clefts. These are cholesterol clefts, the pointed spaces. And it is also a characteristic feature of secondary degenerative changes. So altogether, the secondary degenerative changes are like presence of old hemorrhage. There should be an old hemorrhage, presence of siderophages, calcification like this. These are the calcification, dark pigments. These dark pigments. So calcification and hyalinization of the fibrous tissue, as you can see here, hyalinization and presence of cholesterol clefts, as you can see in this last slide. This is the last slide. Presence of cholesterol clefts. These five are the signs of secondary degenerative changes. Secondary degenerative changes along with excess accumulation of colloid in these follicles. All this point towards the diagnosis of colloid goiter. And other secondary degenerative change is osseous metaplasia. Osseous metaplasia, that is presence of bone tissue in the thyroid, which is not present in this case. Even this is, if it is present, that is also secondary degenerative changes. So this is all about the colloid goiter, which is a benign condition. So if you like this video, please like, share and subscribe to my channel. Thank you all.